Oh, absolutely, Cynthia. Almost a year into the pandemic now, in Brampton, one of the hardest hit cities in the country, will finally be getting 2 isolation centers, and we're being told that they will be opening soon. This comes after Mayor Patrick Brown spent months pressing Ottawa for the funding.
I had previously expressed frustration that the federal government had funded isolation centres in Mississauga and Toronto.
COVID cases in Peel Region continue climbing at an alarming rate. For every 100,000 residents, 279 are now testing positive, pushing the region's positivity rate to 16.7%, a number that is considered very high. And Brampton alone makes up 61% of those infections.
We too often forget that COVID-19 is a disaster, much like a hurricane. Like a hurricane, the death and devastation are real, and the need for supports and impacted businesses and individuals is absolutely crucial.
With isolation centers already operating in Toronto and Mississauga, federal funding is finally trickling down to Brampton, a city that is full of essential workers. More than 14% of households there are multi-generational, making it hard for people who get COVID to self-isolate.
If you look in Brampton, we have crowded living conditions, and if someone lives with 2 or 3 people, it might not be hard to isolate in a different part of the house. But if you live with 10 people, it's virtually impossible. And so having this tool, having this option of a location to safely isolate is critical.
Mayor Brown says the new isolation centers will be located in Bramalea in the northeast end of the city and will be opening shortly. The mayor of Mississauga also gave her first COVID briefing of the new year, saying back in December, cases were plateauing, but are now reaching record highs.
As I've said many times here before, it's not our continued daily high case numbers that concern me the most. It's the situation in our hospitals. Right now, Mississauga Trillium Health Partners is dealing with 135 COVID inpatients, 31 in critical care, and approximately 70 more suspected cases. And that, of course, means that more than 230 rooms at Trillium Health Partners are being used solely for COVID-related patients.
Now, Mayor Bonnie Crombie says 51 healthcare workers are currently sick and off the job, and both Credit Valley and Trillium hospitals are facing staff shortages. So far, 100 patients have been transferred to other hospitals. Today, a nurse from Mississauga represents one of the 37 COVID deaths reported over the last 24 hours. The mother of 2 was on the front lines of this pandemic, taking care of residents at a long-term care home. Today, I spoke with her children, who tell me their mother was a kind woman who lived her life giving back.
Me and my sister will forever know her as like the strongest woman that in our entire life.
Her name was Maureen Ambersley. She was 57 years old and was working here at Extended Care in Mississauga. The nurse of 16 years was also a beloved mom and grandma. She tested positive for COVID on December 24th. By Christmas Day, she was admitted to hospital and was quickly put on life support. She passed away yesterday morning. Her 2 children, Ashley and Floyd, described their mother as a mother to all.
What made her go out that door every day is that she wanted to help and take care of the people she was taking care of.
She loved her clients.
The union representing Maureen and 16,000 other healthcare workers in Ontario released a statement saying that she exemplified everything good about what it means to serve your community, and went on to point out the struggles unfolding in long-term care homes. It must be said that the death of healthcare workers is preventable and the result of ongoing policy failures. As Ontario families bury more workers and residents in long-term care, we reiterate our demand to the provincial government for a new action plan to get us through this out-of-control crisis. As funeral arrangements are now being made, I'm told Maureen also lived and cared for her elderly parents. They too have tested positive for COVID and are both in hospital. Ashley tells me she was always worried about her mom going to work and wishes she had the choice to stay home.
My mom loved her job, but she was scared to get it, and she was scared to pass it on to her parents. And there was no support and no resources for her to take a leave.
Ashley and Floyd want everyone to know that COVID is real. They never got to be with their mother when she died. They will not get to see her body to say a proper goodbye. And they're now making arrangements for a 10-person funeral that will be broadcast over Zoom.